Do we still need doctors, or can AI really handle everything we expect from human care? Good evening, my name is Maia Mazurkiewicz and welcome to the Anatomy of Disinformation. Imagine getting a test result that looks perfect, the logo, the numbers, the doctor's name, and yet none of it is real. That's a medifake, an AI-generated medical document designed to deceive you. It can cost you money, affect your health, and undermine your trust in medicine. Medifakes are becoming increasingly common, but medical disinformation is nothing new. It feeds on our deepest fears. Tonight, we'll talk about what we can do to stop it from getting into our healthcare system. We'll find out whether the law can actually protect us and what doctors can do to stay ahead of this form of deception.
Andrzej Ryś, member of the Polish Medical Research Agency's Council. A former Polish deputy health minister, he's held key leadership roles at the European Commission's health departments, including Director for Public Health and Risk Assessment and Director for Health Systems, Medical Products and Innovation. He is an EU Fellow at Oxford University researching health data and AI in healthcare.
Andrzej, welcome and thank you so much for joining us today. It's great to have you because today we specifically talk about healthcare disinformation and medifakes. And my question goes to you, how significant is the threat around this topic?
We undermine science, we undermine clinical practice, we undermine the institutions like, for example, European Medicine Agency or US FDA work. So basically both intended and unintended ways of informing can bring the same results. And in the end, it will cost the lives of people. For example, unvaccinated children or people, they will not pick up the therapy which is recommended by current clinical standards, or people will not come to the screening services to detect cancer, for example.
So we are ending up that in the information space, we have loads of information that it's not real. So who is behind that mostly?
It's the number of actors is quite big and at least long. I will start from the patients. Patients can be also the source of the misinformation because they, for example, start to be extremely unhappy with the results of therapy or something that's happened to them, or eventually start to promote something which they believe it works and scientifically is not proved. We have celebrities or people, influencers, even, they can be also part of the story. We have such examples in the past. We have business sector, it's business sector for this century, since media exists, started to promote, and speaking about for example, famous case when you promote, the better hairs when you use some cream, and it doesn't really produce any results. We have politicians, of course, they play the roles, also in this process. Important actors are health professionals, especially doctors. So we have very specific requirements. That in some campaigns, the white coats can be not used. We have governments. This is something you discuss in your program quite often. We have also media and journalists because the health is kind of important topic to people. So often the hot news is pick up. For example, the therapy was given to one patient, seems working, and then it's become like a rolling ball, through media. And in the end, of course, we have something which also scientific journals even can produce. We have examples in the past, in the history of science, that in vaccine is example when the MMR paper was published in 1998 in the Lancet, and then somehow started the unbelief in the vaccination, and this seems like a beginning of the misinformation in vaccination. And of course, we have also digital platforms. Depends how you target. You often use the AI as a way. Health is we should remember the health is one of the top search title in internet. And also same time, as we study in the European Union, is one of the most important things to people. So those things are coming together. They really can create quite complex game between different actors and with the presence of those actors.
And it's also one of the biggest fears, especially in Poland. A lot of research is showing that the top fuse of Poles is losing health. So that's why also it's a big part of the influence operations from for example, Russia or other male actors.
Yeah, it is an interesting story. When we prepared the conference in 2019, just before pandemics, about the way the vaccines are attacked by different actors. Remember the paper published this time earlier by one American researcher showing the way the Russians employing the troll farms to spread information about anti-vaccine information. They're targeting also this extreme groups, to feed these groups with the messages. We have seen this, in some countries when really there was a hot political thing around the vaccines, for example, discussing about the obligation of vaccine for children admitting to the public kindergartens. It's really pushed the fear and also the whole debate. And we should not forget the vaccine is a very specific area which we can imagine could be targeted first. We are on the edge of freedom and non-freedom. It's very difficult. I am public health doctor, so for me it's very clear the vaccine is a way to protect population, and of course, same time individuals. But you need to vaccinate, certain level of populations to get the protection to every one of us. So you can imagine it's a target because the discussion about the freedom and non-freedom is always kind of a hotline for this type of operations.
This vaccine is also taken as a parallel for disinformation and protecting citizens from disinformation, and that's where my next question is. Since there was loads of influence operations and disinformation around pandemic specifically, did we learn the lesson, and is it getting better now?
Yeah, there have many lessons. We call this even info pandemic. Yeah, this kind of lessons learned. We learned, for example, how important it is to make sure that the communication is well done by public institution as is coordinated in today's world of media and communication. What is communicated in the US or Brazil or in Europe is crossing the media lines very easily. So this is important not only in the country, in Europe, but also is important to do this across the world. We have seen this in the first pandemic, H1N1, or so-called swine flu, but really we have seen very clearly in the current pandemic, because in these years, the social media became so strong and so important in this world. The second, we learned that we have to clearly communicate, from the governments, from the public institutions. When you cross messages, it's really can create confusion to the public, and of course it's used by unfriendly, or even as I said, as a misinformation by people they want to help. The third important factor is that we really have to employ, the experts the best way as we can. So use experts, and communicate with them and through them, which in a number of cases was not easy. And lastly, I think it's important also to kind of make sure that we are able to fight with the misinformation or disinformation, the ways which can be more effective. I give you an example. The typical story from pandemic was the use of hydrochloroquine, in our country, the other medicines, which simply was not effective. We learned that using this kind of medicine was threat to the population. So people simply die because they were using this medicine, which was not working properly and even produced some side effects. So we really had to be, as I said from the beginning, we are playing with life and death. This is not indirect, it's a direct threat.
Andrzej, thank you so much for joining us, and it's clear that we really need to verify information around healthcare especially. Thank you so much.
Yeah, if I may add what you often say in the end of your program, check before you click.
Tonight, we expose how medical misinformation goes viral in all the wrong ways, spreading faster than the facts that are supposed to stop it.
Medical disinformation has become one of the most serious public health challenges of recent years. What once existed on the fringes of the internet now spreads rapidly through TikTok, Instagram, YouTube, and influencer culture. Doctors increasingly report that patients come to appointments convinced of false medical claims, a shift that fundamentally changes how modern medicine is practiced.
You have this environment, the social media environment, which is great at picking up things and amplifying it. Humans are very attracted to that, so there's a psychology side of all of this, a cognitive side. And you also have bad actors injecting things in all the time.
A recent survey of physicians showed the scale of the problem. 61% of doctors say they encountered patients influenced by disinformation a moderate or great deal of the time. An overwhelming 86% report that the problem has grown over the past 5 years, and 57% say misinformation now affects their ability to provide quality care. In Poland, the government has proposed a major legislative reform widely referred to as the Quack Law. Published in June 2025, the amendment to the Patient Rights Act aims to counter harmful pseudotherapies and unqualified holistic healers. The proposal would prohibit advertising unproven healings, require non-medical practitioners to clearly disclose their lack of qualifications, and give the Patient Rights Ombudsman the power to issue fines of up to nearly 500,000 euros. Case studies from recent years show why legislators say such measures are needed. In Poland, practitioners have offered dangerous interventions, including starvation regimens for autistic children and intravenous DNA cleansing.
I think it's one side effect of the public's relatively low awareness of illnesses and how they're treated. It's also probably a result of desperation on the part of patients who've received improper or insufficient medical care. That's why they turn to alternative options that aren't always in line with the latest medical science and aren't always safe for patients or their families.
One medical facility continued using high-dose vitamin C infusions, curcumin drips, and bioelectrotherapy for cancer patients despite unanimous expert findings that these methods had no scientific basis. After ignoring the Ombudsman's order to stop, the clinic was fined nearly 60,000 euros. Courts have also disciplined doctors who spread anti-vaccination narratives during the COVID-19 pandemic.
Do you ever diagnose yourself before you even see a doctor? Do you trust ChatGPT more than medical professionals? And who's feeding us these magical quick fixes that promise health in a heartbeat? Let's talk about all that and more with our next guest.
Dr. Maia Mazurkiewicz, specialist in clinical toxicology, internal medicine. He earned his doctorate in medical sciences after defending his dissertation titled Acute Poisonings in Suicide Attempts Among Women in the Premenopausal Period. He serves as a regional consultant in clinical toxicology in Poland.
Eric, welcome and thank you so much for joining us today.
Thank you for your invitation. It's kind to see you. Thank you.
Thank you. We're talking today about medical disinformation, and you as a doctor, do you have a lot of patients that are coming and saying, hey, doctor, I know everything, I just need this and this because I already checked it with ChatGPT?
Well, yes, that's a problem at the present time, and it's a very frequent problem. People use different browsers just to find the information, just to check. When something is going wrong, they want to know immediately what's going on. And sometimes when they arrive on a visit, they have a diagnosis and they would like to discuss, they would like to find additional information, or maybe sometimes they would like to check my knowledge. Is it new or not? And then we discuss what they found. And sometimes I joke that whatever you put into the browser, the final information is that you have a cancer. And you have a very simple symptoms. And when you look through all these informations, the final one is like this. And sometimes people are frightened about that because they are anxious is it true or not? But that's true. They look through, they would like to check something to find, and then to confirm the diagnosis and to discuss, and they would like, of course, to hear that it's not as serious diseases as they expected.
And one of the newest things that we see is medifakes. So the test results, they are fake. Have you already seen something like this? Are you already checking the test results, if they are real or not? A lot of them are already in the online, right? So perhaps is it easier to check or harder?
Yes, usually, yes, I do, because I would like to confirm the laboratory if it has any regulation, if I can trust them, if they have some test, outside test. Now we have an easy access to different examinations, laboratory place to do. Not all of them I can trust, and it's difficult, to check whom I can trust and whom I don't. And what's more, not only laboratory testing, I have to match the laboratory test and the physical state and the symptoms patient observed, and just when I connect it, the final diagnosis I can match, because when I will interpret the laboratory test, not outside the patient, or to share the patient and the laboratory test, I can make a wrong diagnosis, wrong conclusions, and the treatment will not be sufficient.
Do you feel that still patients trust you as a doctor more? Or are they already trusting more something that they find online?
Well, it depends. I think that in general, people trust doctors, and maybe me as well. And some just want to find another source of information. As I said, they would like to have very fast what's happened. Why does it happen? What is it, the symptoms? And in an everyday practice, sometimes it's very difficult, because we have to find for a laboratory test, some symptoms appeared and disappeared. So there are some limitations, and we are in general impatient, and we would like to know very fast. And maybe that's why they look for this information, which, in my opinion, is sometimes very clear, very short, very convenient, and it's easy to believe that information. And when they met with the everyday practice, with the reality, that sometimes access to any examinations is difficult, when you have to wait for different things. So I think that's why they try to find this information is in another source, not in my outpatient clinic, for instance.
Are there any specific examples of what patients use because it's giving them a sense of instant health, and they find it in the internet?
Well, I remember, maybe it's typical for Polish people, but people use mushrooms, for instance, to treat different diseases. The most popular is Amanita muscaria, a very popular mushroom in Polish forests, and they use it for arthritis and for some ankle pains, which, of course, doesn't work because it does not have these substances. But if someone with very convenient way advises to use these medications, maybe someone will do that. And when they strongly believe that it helps, maybe it happens. But
like
in
a
general,
placebo.
it's a fake news. It can't help us. It's not possible, because this mushroom does not contain any special substances that could cure my diseases. And people, as one of my patients, use a very strange and very dangerous procedure, which is, for instance, a combo rituals, when you apply a discharge from frog from South Africa on your skin just to clear up your body, just to eliminate toxin. It's not possible, because toxins are not in my digestive system. They are in organs, and this procedure will not remove it.
what are the most important things that every single person that is having a concern about the health should do?
I think that the most important thing is a trustment. We should trust each other, trust the doctors, and trust that I do as much as I can. I do in the best way, and I try to do my best. And on the other hand, there is maybe not an institution, but a tradition of second diagnosis. If this first diagnosis does not satisfy me, maybe I'm not convinced enough, I can go to another doctor and to just ask whether the first one was right or not. And yes, I can understand that maybe if I will be in need, I will do the same. And during the study, I also heard about this as an institution, the second diagnosis, and I accept it. But I can't accept situations when people look at the browser and different unproven publications and unproven scientists or I don't know, strange people, and believe them not to the conventional medicine.
I think the secondary notice is something that we all should take in terms of disinformation and how our information space looks like right now. If we are doing that with doctors, we should definitely do it with other sources as well. So definitely let's verify.
Yes, I think, yes. As I said, I will do the same, probably just to find a confirmation, the first diagnosis on the second one.
Eric, thank you so much for joining us today.
Thank you.
Now let's find out what you can do to protect your sensitive medical data.
Trust doctors more than AI. Check sources before sharing any medical news. Protect your medical data and don't share it online if you don't have to. Targeted action and cybersecurity innovation are the only ways to ensure that the benefits of digitalization in medicine are not compromised by the risks of deepfakes.
We often talk about disinformation in politics, but it doesn't stop there. It can shape our choices, our fears, and our health. AI can be brilliant, but it can also create dangerous illusions. So when it comes to your health, trust your doctors, and don't forget to keep calm and think deeply.